throughout our lives. And so this is a really broad set of topics. And so each week we hope to be able to bring kind of whatever the hot topic of the week or the month is, and it'll range, and some of it will be driven by the current media.
That is, it happens a lot because people end up getting a lot of questions. The media sort of sets the agenda in those situations.
Yeah.
We see that happen quite a bit with various diseases.
Yeah, the last month has been a big topic about vaccinations with the measles outbreak that just has been a huge outbreak compared to the past 10 years.
Actually, the two of you can calm people down because over the years in media, I knew that when we were doing stories about flesh-eating bacteria and various topics, that your chances of ever coming across something like that might have been hundreds of millions to one. It was great to drive ratings and eyeballs to TV sets at the time, but to talk to your local doctor, your local doctor probably was rolling his eyes or her eyes at the time hearing some of this.
And if I can jump in there too, this is PA Russell Singleton, but I hope we can provide too just a voice of reason. I think there are a lot of folks out there that don't have a family doctor. They don't really know where to go for good health information. They're left to the internet or to the media, and I think a lot of times that does drive confusion. So Dr. Tripp and I hope to be a resource, a trusted voice that you can rely on for just good old-fashioned but still up-to-date medical information coming each week.
I was going to say, in this day and age too, and I'm new to town, and therefore I end up with a new insurance policy, and in this day and age, there's lists people have to go down and preferred places that some insurers will try to send you. And for the average person, it's a minefield sometimes to walk through all of this, and hopefully we can answer some of those questions too as well.
Absolutely. In fact, kind of the benefit of a smaller practice and the big push in the medical societies at this time, as well as the government, is they're looking for people to get what's called a medical home. And they push it like it's a brand new idea where you can take the whole family to one place, mom, dad, the kids, and really have a resource of understanding of the family as well as the individual. You know who you're seeing. Our staff knows who you are, and you have a place to go for these questions. And you have, whether it's questions on your insurance or whether it's your health, the contact you came into with the neighbors, do we need to worry about this or worry about that? That whole medical home idea really goes right back to the old country doc that really is what family medicine is about. And that's the excitement of what our office provides.
And I completely agree with that. I think that's a great segue into something that both Dr. Tripp and I really believe in, and that's preventive medicine. That's focusing on health, on wellness. We do want to see you when you're not well, when you have a cough or a cold, or you have an issue with your blood pressure or diabetes or arthritis. But we want to help you stay well. And we want to focus on things that will help you do that. Everything from smoking cessation or medical weight loss to we even do a lot of cosmetic work in the office because it's part of our overall picture of being well and being happy.
Hold those thoughts for a moment. We have a short break coming up, but more from Tripp Family Medicine. The program is called Better Health. That's on the way in just a few minutes on News Radio 1310 KLIX. A couple of guests with me in the studio until 9 o'clock this morning. We're calling it Better Health with Tripp Family Medicine, which is located, in fact, it's on Fillmore, right across from the main post office here in Twin Falls. Luckily for me, I'm a newcomer, but I knew where the post office was. So when I went there last week to meet with these two men, it wasn't difficult to find. And I was mentioning earlier, it's a well-appointed area. The office itself made me feel like I was sitting in some corporate waiting room. It's so plush. We probably shouldn't tell people that, should we? But it's a nice.
It's the nicest
atmosphere.
office, nicest medical office I've ever worked in, and I think the biggest reason is because it was built to be kind of executive suites, and it has big windows, feels open, does not feel sterile or industrial at all. And so I agree. I like going to my office every day.
Dr. Jonathan Tripp, along with Russell Singleton, physician's assistant, joining us in the studio. 8:43 right now, 26 our temperature on News Radio 1310 KLIX and newsradio1310.com. And we were having a bit of an off-air conversation just about the differences in the titles people have in medicine. I have a friend in Florida who's a nurse practitioner, for instance. Then we have physician's assistants, and then we have MDs. And a lot of people may get confused by some of these things, but everyone has a very important role to play.
Well, let me tell you about what a DO is, because a lot of people are confused by what those letters mean, because DOs represent only about 5% of the medical doctors in the U.S. DOs and MDs are the only two full-fledged surgeons and physicians in the U.S. are recognized that way. And DOs have a little different training in that they learn a lot of hands-on skills called manipulation, which is a lot like a chiropractor or a physical therapist, combined with the MD understanding. The schooling is a little bit longer. And just to give you my background, my training was alongside MDs all the way through medical school in Missouri. Most of my postgraduate training was in Detroit at Henry Ford Hospital, which is a 900-bed hospital, so a very academic location. And then my last 2 years were through the University of Wyoming in Casper, Wyoming, so I got a little bit of the cowboy experience as well. But that brings a pretty well-rounded point of view for a family physician to have very intensive training, but also to be the lone guy out in a small town emergency room as part of my training. So you really do
You've
learn
seen everything.
where the buck stops, and it's with you. And so let Russell tell you a little bit about PAs, because my first PA that I worked with in Texas was actually the primary care provider for the Vice President of the United States. So PAs are very valuable practitioners.
Thanks, Dr. Tripp. Being a PA is absolutely wonderful. It's been consistently voted as one of the top careers in the country, and I think there are a number of reasons for that. Number one, I get to work with great doctors like Dr. Tripp. Number two,
I paid him for that.
oh, that's right. But then number two, I get to be a part of one of the greatest movements in medicine, and that's primary care. I feel like Dr. Tripp and I at Tripp Family Medicine are on the front lines of medicine. We are kind of, not the gatekeepers as you would have heard maybe 10, 20 years ago, but we're the first line of response. And then as a PA specifically, my training was also in family medicine and in primary care. I have a undergraduate degree in public health and health science from Brigham Young University, Idaho, where I actually teach now. And I have a master's degree from Idaho State University that has trained me to practice medicine alongside with a physician. And I think that's an important distinction to make. A PA will practice alongside a physician. It's not my duty or my role to replace Dr. Tripp. I'm not his surrogate. I'm his partner. I'm someone that can help him better care for the population. I think having a PA in the office allows us to do a lot of things that maybe other clinics can't do. We can see more people. You don't have to wait a week or two to get into our office. We can see people that same day for the urgent stuff. And in this day and age, that's becoming more and more of a rarity. But then I think the other goal that I have is to just add insight. Dr. Tripp and I consider ourselves a team. He's the leader. He's the captain of the team. But we confer and consult on almost every patient. And so when you see one of us, it's not that you're seeing just Dr. Tripp or you're seeing just Russell, the PA. You're seeing us both. You're seeing the team at Tripp Family Medicine. And I think that team approach is something really unique. Dr. Tripp kind of mentioned the idea of a medical home, and he mentioned the idea of having, one place for the entire family. Well, we absolutely believe in that, and we believe that that kind of care is best delivered by a team, and that includes our wonderful nurses, our excellent administration staff, and it's really a whole family affair, I guess you would say.
Hold those thoughts for just a moment. We're coming up on 10 minutes of 9 o'clock and 26 at our studios, News Radio 1310 KLIX and newsradio1310.com. And, of course, Bill Colley with you on Top Story. And this morning, better health with Tripp Family Medicine right here in Twin Falls. And we want to point out Russell Singleton talking about his work as a physician's assistant. And of course, Jonathan Tripp, Dr. Jonathan Tripp, giving us a big overview here. One thing I noticed related to that, what you were just talking about, Jonathan, or rather, Russell, was when I was in the office last week, that camaraderie you have with the patients who are coming through the door.
Yeah.
And, we hear that sometimes medicine has become almost an assembly line.
Yes.
But it didn't seem that way in your office.
Yeah, we were easily interrupted by patients who it was kind of like old home week. Yeah, in fact, that's the fun of having a private office. We can portray the atmosphere we want, and I tell my staff as they get hired, I said, this job is way too much work to not have fun. So if we're not having fun, I don't want to do this. And the patients get that. They see that. So it's a one-on-one personality. It's a one-on-one relationship. It really is a family environment.
And doctor, I know you don't really want to criticize the way it works anywhere else, but I have been in those situations where, you are in and out the door, and you barely get an opportunity to delve into what you think you're there for when you're talking with the doctor, and then the doctor has to rush off. They're running around with their laptops and they're plugging them into one wall after another, seeing everyone else. But people still like that. As a patient, I still like that approach, that personal approach. And I think they're getting more out of that in the long run.
I think so too. In fact, one of the greatest teaching points I ever received was if you listen long enough, the patient will tell you what's wrong. That doesn't mean they get it in the first minute. However, I also understand, physicians, practitioners are under pressure to see people quicker, move them out. The good news is we don't have a quota. We don't have a system, a corporate system that tells us you need to do this and you need to do it in this many minutes. That we try to be efficient. We don't want people waiting in the waiting room very long. But at the same time, if somebody needs more time, if it's more of an emergency, we try to tell everybody else around, hey, we got backed up because we had somebody that came in short of breath or came in with a new laceration or came in, with chest pain. And boy, that needs greater attention right now in spite of the fact that somebody else had an appointment right then.
And to Dr. Tripp's credit, I think he has devised a way to increase that efficiency but still maintain that personal relationship. In our office, you won't ever see a laptop between a provider and a patient. That just doesn't happen. Maybe on a rare occasion, because we use our excellent and well-trained nursing staff to act as scribes, and they are absolutely wonderful. And they allow us to sit face to face across from our patients and talk to them and listen to them and look them in the eye. So I think that's, again, an oddity in today's medicine.
Yeah, the barrier isn't there, and that is a complaint of electronic medical records, that the patient comes in and feels like the doc spends the whole time inputting on the computer, which I understand because I hate doing charts late at night, but that's pretty much what I do.
It's not a 9-to-5 job, right?
No,
that's
it is
for
not.
sure.
I can second the chart thing, by the way.
That's right. Yeah. When we finish at 5 or 6 at night, that's just the beginning of the day.
It does remind me a bit too when we were kids, and if we had a bad cold, we would go see the doctor, and oftentimes all it took was a call from my parents, since they had a personal relationship already, and someone would say, bring him right in. And in this day and age, I just talked to a friend the other day who needs knee surgery, and they said, well, we'll have to do it on March 19th, and we'll have to do it. And this is an individual who's been waiting for this surgery for weeks already.
Yeah.
But you have an opportunity to bring people right in the door and say, all right, if you've got something that you think is serious, we'll take a look at it.
Yeah, and if we need to move it on to like a surgeon or someone else, and cardiologist, whatever, we have the ability to call and usually move that up rather than what the patient would be able to do otherwise. So
you see a lot of...
We really do facilitate a lot of the expert care, and but because we have a broad range of training, including emergency room and dermatology and even some cosmetic stuff, we see the little kids that are having trouble breathing. We see, I mentioned laceration. I had, somebody walk in at 5:30 about 2 weeks ago, and just happened to, everybody else had left, but me and one nurse were there, and he walks in, cut his hand with a box opener, and
yeah, in fact, they usually show up on my lunch hour too.
Yeah, that's true. That's true. Let me give you a little smattering of kind of a typical day in our office. I said we do a lot of dermatology. 2 days ago I did 3 different biopsies on, potentially threatening skin lesions. At the same time, I saw a kid for croup, another one for asthma. Uh, Definitely follow up on hypertension and diabetes. Um, you pick it. We had probably the day before a young lady who fell and had a bad dislocation of her finger, but the dislocation actually cut the finger open. So it's for most offices, that's an orthopedic emergency. You got to go to the ER. Well, we saw her. I relocated the finger. We got the x-ray. The orthopedic surgeon looked at it because I made the phone call and said, hey, there's no evidence of fracture. Sew her back up, put her together, put her on an antibiotic. She never had to go to the ER. Saved probably over $1,000 by coming to our office. Got quicker, at least as good a care. Had an orthopedic surgeon consult by phone. And, that's the success of family medicine.
It's an alternative now to what we're seeing with the more corporatized
Yes.
offices. And it's funny, it's not alternative medicine, but it's an alternative to what most people really don't like and I think sometimes fear.
Yeah, and if I can go back too and just touch on that preventive focus that we have throughout the day where we're taking care of these acute issues, we also have the wellness exams. We do the female exams, we do the well child checks, we do all types of wellness exams for adults. We do the DOT exams, exams for BLM firefighters, Boy Scouts, all that kind of thing. And then one of my areas of interest too is that medical weight loss that we kind of touched on before, and that's a huge part of our practice. And it's not only that reactive medicine, but the preventive medicine too.
Yeah.
For people who are tuning in today, and if they're not familiar with the office, you have room for additional patients, right?
Absolutely.
Where would they go if they wanted to contact you?
There's our website, trippfamilymedicine.com. Phone number, that's easy to give, 933-4400. Google is always a good spot for us.
And that's Tripp, TRIPP, familymedicine.com, by the way.
I forgot I have to spell that. I've grown up with that name my whole life.
Yeah, I don't know.
Hey, let me throw out,
Same way.
speaking of which, the excitement of this office is we will have been around 3 years next month. So we're still kind of the new guys, but we're well established. We have a snowball effect of having had good care. Most of the new patients we're seeing, or I can't say most, but a lot of them are the final member of the family to show up and say, well, the rest of my family's coming here. I
Yes.
might as well too. But we just have more new patients than most offices every day. In fact, other offices I've worked in, they see 1 or 2 new patients a day. We see 6 to 8 every day new patients. So we're
There's still
growing.
room to grow, absolutely.
So we're in desperate need of more nurses. We like LPNs or even medical assistants. So anybody that is looking to work at a nice place, come see us. We're also looking for another mid-level, like a nurse practitioner, another PA like Russell.
And next week, what we'll do is we'll delve into some issues, health issues, and talk to some folks too who might have a question or two. But I'd like to thank both of you for dropping by today. Good introductory meeting, if you will. And we want to point out 9 o'clock news is coming up. Want to thank both Dr. Jonathan Tripp and, of course, Russell Singleton, physician's assistant, joining us from Tripp Family Medicine. The show is called Better Health. They'll be back with us in just 1 week.